Welcome to the Art of Healing with your host, Dr. Judy Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Good to be here.
Yeah, this one's going to be fun. I really like it. And right on the pre-show, when we were talking about it, I was asking my wife this morning what we should talk about today. And she goes, you know what? What about dental care? And then right when Dr. Judy and I were getting ready for the show today, Dr. Judy's like, I've got a couple of ideas, but I think we should do one on dental care. And I was like, that's the answer. That's exactly what we're going to talk about today.
See, always listen to your wife.
100%. I don't even debate that one. It's not even worth an argument about it because ultimately I married up Dr. Judy.
Yeah. Okay.
Like everything is better like when she is leading the helm. So yes, we are going to heed to that advice today. So we are talking about the importance of dental care for your dog. So let's get into it. What made you bring up this idea for the topic? What's got this in your mind today?
Well, something that I talk about to clients quite a bit, and it's really, really important for pet health. And this is for, dogs and cats both. So this can apply to both species. There's a lot of, when we look in the mouth, and you can look in the mouth and see if there's tartar on the teeth and if the gums are inflamed, does the breath smell stinky, all that stuff.
Okay.
And then, okay, my pet probably needs to get in and get some dental care. We're supposed to go in and get our teeth cleaned once or twice a year. Right. For general health. And it's the same for pets. But sometimes there can also be a lot of hidden disease in the mouth. There's actually more tooth mass below the gum line. This is in the form of roots, and especially in dogs, some of these big teeth in the back of a dog's mouth, there's more tooth root than there is tooth that you can see. So that's a lot of tissue that can get diseased, can get infected. And sometimes you never know it. You'd think if the dog had an infected tooth or a cat had an infected tooth, that they'd be acting really painful, but sometimes they don't. Sometimes you don't know actually how painful these are, because they are painful. If anybody out there has had an infected tooth, these really, really hurt. Sometimes you don't even know how much it's affecting your pet until you get it taken care of. And then I'll hear these stories all the time. Oh my gosh, my pet has so much more energy, or my dog wants to play ball again, or chew on its toys. It had quit doing all that. And sometimes it's written off to the fact that the pet's getting older, or other reasons, but it actually can be because the mouth hurts. The other reason, this comes up a lot is there's a lot of fear around anesthesia for pets. Because in order to do a really good job with dentistry, you have to get in the mouth and not only do a thorough exam, but you have to take the x-rays. Well, x-rays are part of the exam. If you're not getting the x-ray taken, you're not getting a look at the tooth roots where there can be all of this hidden disease, like I've been talking about. And there's just no way you can get good x-rays of the mouth without anesthetizing a dog or cat. And the technique is the same as if you or I go into the dentist. You got to hold those little biting things in your mouth, and it's the same thing. So you're going to get your dog to do that when they're not anesthetized. There's just no way that's going to happen, and they're going to hold still to shoot the x-ray.
Right. Or bite your hand off.
Yeah, right. Yeah. Exactly. Or destroy the equipment. Everything's digital. You actually have a digital plate that you put in the mouth now. And those things cost thousands of dollars. So you're not going to want to do that in a animal that's not been anesthetized.
Mm-hmm.
So it's really important, and it's really important to do the anesthesia and get
Mm-hmm.
the full exam done, and then you know what needs to be done. I also recommend going to a dental specialist. There's
Mm.
over the last couple of decades, there's been a lot of advancement in veterinary dentistry.
Mm-hmm.
And I mean, I used to clean teeth all the time. I wouldn't be comfortable doing it these days unless I got advanced training,
Right.
because 20 years ago, the training wasn't available. Now there's advanced techniques, and there's a very big difference in expertise going to a dental specialist as opposed to going to a general practitioner that
Mm-hmm.
also does teeth cleanings. And a lot of vets do, but the specialists, they have a deeper knowledge base. A lot of them, this is all they do is dentistry. So all their continuing education, they're keeping up on the latest dental techniques, as opposed to a general practitioner that's keeping up on everything, all the different topics. And then they also have better equipment. I started taking my little chihuahuas into a dental specialist, and their recovery was so much better. And I mean, one time I took each of them in, this was within the same year. And they each had 8 teeth extracted. And I've looked in a lot of animals' mouths after they've had teeth extractions, and I was amazed at how little inflammation was there. And this is just because the specialists have better techniques. This is all they do. So I do recommend going to a specialist. It costs a little bit more money, but I feel that it's well worth it. And because they anesthetize every single one of their patients, I consider them experts in anesthesia. They're, they have to have really good, safe techniques. And really, anesthesia safety is about the monitoring. You want to have, and this is a good question to ask anytime you're taking your pet in for a procedure that requires anesthesia, is there a technician there dedicated to monitoring that pet? You want somebody there taking vitals during the whole procedure, not just running back and checking in every so often, because the key is the heart rate drops. They're not, breathing as well. There's these subtle changes, and you get on top of it, you make adjustments, and you don't get into trouble. Where I think we get into trouble with pets and anesthesia is they get too far down the road before somebody realizes it.
Right.
And then sometimes it's hard to go back. So I know anesthesia is scary, but even in older pets, I mean, my pets are 13 and a half. They've both gone in for their dental procedures this year because I really feel that it's important. You want to do blood work first. You want them to have a good physical exam, make sure that they are in good health. And you want to go to somebody that does, has this extra level of expertise and is really, really careful with the anesthesia.
Yeah. Knows what they're doing with it. So on a side is within a dog's mouth, I do know that we have nerves on our front teeth that run up to our brain. So it's a direct channel. So when we damage, and it happens with multiple other within our jawline as well, is where the nerves are transferring up and hitting our brains neurologically. Does that same thing happen with a dog?
I think more from what I know, the nerves are more local. I mean, they're going to extend up into the bones around the facial bones and up into the sinus cavity, like up in that area. I don't think they necessarily go up to the brain, but all the nerves are still ultimately connected to the central nervous system. That's why I remember having an infected wisdom tooth once, and oh my gosh, like your whole head is throbbing, from the pain once those nerves get irritated. But I think from a pain perspective, if you had an infected tooth, a damaged tooth, that pet could be in a lot of pain, really having like a massive headache. That's why they don't feel like moving around. You know, if your head hurts, man, you don't feel like being active. And dogs especially can damage their teeth. I mean, they can crack them, they can break them, they chew on stuff. If they're crated or kenneled, and some dogs will chew on the kennel, you know, they'll pull on it, and they can really do a lot of damage and a lot of trauma to their teeth.
So how would I identify in my dog if I should take action on dental care? So you were talking about, teeth that were, rotten, that had, basically started to deteriorate within the mouth. What kind of things should I be looking for?
You would see things like, well, first of all, tartar. I mean, look at the teeth. And if, you see that heavy layer of tartar on the teeth, inflamed gums, the gums look really red. The breath is stinkier than normal pet breath. Like smells infected, kind of dead, really like, okay, get out of my face kind of breath. Then that there's something going on there. Discolored teeth, obviously broken teeth. I mean, sometimes you can look in the mouth and see that a tooth has been broken off. Sometimes they're fractured. Sometimes they're slab fractures, like just the outer layer of the tooth has broken off. Sometimes you can see those things. Reluctance to behavioral changes. So like I said before, all of a sudden they don't want to play with their toys, or they only chew on one side of their mouth. That's something you have to watch them real carefully. Or if they play with toys, they don't want to bite on one side of their mouth, or they do bite on one side of their mouth and they act painful.
Yeah. Yeah, it's like us. I mean, anytime we're hurt, we try to avoid that pain as much as possible. So with that, when you're walking down that road with just getting dental care and looking at that type of stuff, we've noticed that a lack of calcium allows those bones to become more brittle in the mouth. When we see mineral patterns that have low calcium, but also the corresponding minerals that build healthy bone structure, like phosphorus and magnesium. So really is when we start to, we've told individuals that if they are seeing their dog's teeth are breaking, go see your vet and get a test done and determine what nutrient they might be lacking in their diet that is not building that strong bone structure inside the mouth. So you also talked about a specialist, a dental specialist. What's the best way to find them? I mean, do I Google search dog dental specialist? Because I know that if I, called my old conventional vet and said, hey, do you have a dental specialist? Most likely their answer is going to be yes, we do dental care.
Right.
But whether it being a specialist or not. So what kind of questions could I ask to point me in that right direction? Or how would I find them? What could I search for?
Well, I have names in our area, in the Denver area. I know of some veterinary dentists here that I can help people find. I think if you did Google veterinary dentistry in your area, that you would find some of the specialists. I think it would be more likely that the actual specialist would come up if you did Google that, and that you'd actually find a dental specialist that way. Another thing you could do is call one of the specialty clinics. Here in the Denver area, we have these big specialty clinics. You have your neurologist and your ophthalmologist and the orthopedic specialist, and they don't necessarily have dental specialists, but you could call them and ask them, and they'd be more likely, I think, just to tell you, because it would be more objective. Especially if it's a service that they don't offer, they would be, more objective and say, oh yeah, we know of, so-and-so in the area. But I know here in the Denver area, there's down towards Colorado Springs. There's a couple more down that way.
Yep. So really going into a Google search and typing veterinarian specialist, and you could possibly also ask the question at that time too, do you specialize in veterinarian dental care?
Right.
And I would imagine you would receive a certification or some sort of a piece of paper from the organization that taught you this knowledge about dental care. And that's something that you could research as well.
Right. And like, have you had some advanced training? Because there are definitely courses that veterinarians can take that help improve their level of expertise. And so you could ask about that specifically, and you can gauge by the answer that you get. If it's vague, very non-specific, then they're probably just saying that, or they don't know what you're talking about, or something like that. But I do think it's really important. And there are different levels. There are some veterinarians that actually will get some advanced training. There are training courses for the general practitioner that wants to do a better job with dental care. They're not the dental specialist that's all they do, but that's still a level up. And so that would still be something that would be worth pursuing if you could find a general practitioner that had that advanced level of training.
Okay. And, you know, and another point that you had made about receiving anesthesia to, you know, because I'm going to agree with you. There's no way I could put my hands in Leo's mouth. I can check his teeth, but if it gets too much and it's almost, and it's not like he growls, but he kind of, you know, that he's like, I'm about a second away from letting you know I don't want your hands in my mouth anymore. So yeah, so putting, you know, having, you know, really anesthetizing your dog during that process, you're saying that it's definitely worth any amount of risk, but it sounds like there's not that much risk if they are really have a technician that's monitoring, if they're doing all of the steps and processes the right way. It's something that really the risk has been mitigated or removed.
Yeah, I would say there's always some risk with anesthesia.
Sure.
But a lot of the risk is mitigated by careful monitoring. I've heard the saying that there is no such thing as safe anesthesia. There's safe anesthetists. So it's the people, you know, choosing the drugs and, you know, choosing the correct dosage of drugs and being there to monitor, having appropriate emergency drugs. If something does happen, the blood pressure drops, do we have the crash cart there so that we can give the appropriate medications to get the blood pressure back up? Are the technicians trained in CPR? Do they know what to do if we should have a cardiac arrest? You know, it's biology, so those things can happen. But having, again, a dedicated technician, somebody that's highly trained in anesthesia, and like I said, these dental specialty practices, they anesthetize all of their patients. So they have to do a good job of doing that. And it's also important to get blood work done for pets that have heart murmurs, that do have concurrent disease. You want to get an echo. You want to have them evaluated by a cardiologist and make sure that they're safe to be anesthetized. So there's things you want to do ahead of time too, to make sure that they're safe, you know, for the anesthesia. And it can be done safely. You know, there's different drugs that can be used. Another thing that the dental specialists do is they do nerve blocks. When they do the x-rays, clean up the teeth, they find bad teeth before they go in and start working on those teeth. They block them, just like when we go to the dentist. So the pets are numb, so they don't have to be at as deep of a plane of anesthesia while they're getting the dental work done, because the teeth are numb, and those blocks can last up to 24 hours. That's really nice. And the pet can recover from the anesthesia without the dental pain. And then they're fully recovered from the anesthesia before the teeth start hurting. Otherwise, I've seen pets waking up from anesthesia with painful mouths, and they're disoriented and their mouth hurts. And that can be really, really stressful for them. So when they don't have that dental pain, waking up, that makes a huge difference. So that's another great question to ask if you are taking your pet in for dental care, is do they do nerve blocks, and do they do these long lasting nerve blocks?
And I think that's a great question to ask, because you make a great point. I mean, anytime, if you've ever been out with anesthesia, you wake up and you're disoriented and you kind of trying to put the pieces back together because it happens so suddenly, how you go out. Well, your dog is the same. They're going to enter into a strange environment. They're going to be disoriented. And then all of a sudden, if you add mouth pain to that
Mhm.
whole scenario, that's pretty traumatizing for anybody, any animal that's out there. So definitely check to see if they're nerve blocking, like you said, on that side, so that your dog does come back to somewhat of a state of at least no pain. They may not know the environment, they may not know why they're there, they may be disoriented, but you have the opportunity to remove the pain element out of that.
Yeah, absolutely. Absolutely. I think it's super important.
Yeah. Well, thank you so much for going through all of that. I really appreciate it. So, for everybody watching, what is the best way to get a hold of you?
Well, my business name is Animal Healing Arts. My website is ahavet.com. My email is info@ahavet.com. And the phone number is 720-515-2421.
And I highly recommend taking the steps, reaching out to Dr. Judy. She's offering consultations. And even with COVID winding down and all the lockdowns, she definitely does in home consultations and she is brilliant. And what I love about Dr. Judy is she sits and asks questions and talks to you about what your concerns are. And it's not really a come in quick, get them out, turn them and burn them like what we see in a lot of medical practices today. Is Dr. Judy is going to take the time with you so you understand on that level so much more, whether it's dental care or whether it's nutrition or whether it's anything else out there, somebody that's going to actually support you and be with you along that journey into a potentially very trying time, and especially if your pet has cancer. And Dr. Judy, being the cancer specialist, she definitely knows which are the right questions to ask. So I would highly recommend everybody that's watching to take some time with Dr. Judy, or just go to ahavet.com and just research her, get to know her, get to, take a look at some of the newsletters she's written. So you are a wealth of knowledge, and I'm so honored to be doing the show with you every week.
Oh, thank you, Matt. Appreciate that.
You are so welcome. So you can always find us at Parsley Pet. We are going to do nutritional testing on your dog, and we can test over 48 different minerals in the body and also 7 different heavy metals that exist in our environment. And we can test those at a deep level at parts per billion at an intracellular level. And we can do it all by hair. So it's non-invasive to your dog. So if you want to know more, come see us at ParsleyPet.com. Or you can also send us an email at hello@parsleypet.com and get to know a little bit about us. Also, if you like this show, reach over and click the like button or follow us on Facebook. Follow Dr. Judy on Facebook. And this is just goes into helping support us. And we know that we can pair content that you want to see. So if you have an idea for an upcoming show, definitely put it in the show notes and we monitor those and take a look at them. We want to make sure we're producing shows that you really like and that you want to see. So thank you so much for being a part of the show today. Thanks so much for watching. And Dr. Judy, I hope you have an incredible rest of your day.
Thanks, Matt. You too.
All right. We'll see you guys later.
Bye.